Welcome back to another HRG Outbreak Outreach webinar. We're so happy to have you here with us. It is starting to feel like we are seeing some light at the end of the tunnel in this crisis, especially here in Idaho. But as we continue to navigate, HRG is continually committed to sharing industry updates and best practices each Thursday morning. We have 3 more webinars lined up, and we'll talk about those at the end of this presentation. Before we get started, just a couple of housekeeping items. To make sure that we honor the time that we've allotted for the webinar, we will answer any questions that come up in an answer sheet that will be sent out later today with the remainder of the webinar resources, including the slides and the webinar recording. We understand that successfully managing your team and all responsibilities can seem overwhelming in this time with so many changes to the way that we do business. HRG President Greg West is joining us again this morning to discuss the problems with revenue cycle procrastination and the best ways to combat it. Greg, go ahead and take it away.
Thank you, Taylor. I appreciate the introduction. I want to start out with another thank you, and that's to all of you that have signed on to the webinar and all of our peers. You see a lot on TV of people giving thanks for the doctors, nurses, the janitors, the grocery workers, the frontline workers, and certainly they deserve it. But as I sit and watch, there's another group of people who deserve thanks, and that's all of you. You keep your healthcare organizations financially healthy. If it wasn't for you, there would be no masks or ventilators or doctor and nurses' salaries being paid. So it's you that keeps it going and keeps this possible for now during the crisis and in the future. So give yourself a pat on the back. You're probably not going to hear a lot about the revenue cycle people, and thank you to you on TV, but I want to recognize you as you're a hero also. So as you look in the mirror tomorrow morning when you're getting ready for work, remind yourself to say thank you to yourself too. You're a hero and you're making a difference in this crisis, and you make a difference in the future. So from the bottom of my heart, I want to say thank you. Now, the purpose of our webinars is to keep education and stimulating thoughts going during this time when we're not allowed to do conferences and other events that can't happen now. So we're giving you in our swift half-hour presentations something to think about, reminders, and just this is helpful keeping the education going. As I was watching the names sign on this morning, it was almost sad that I can't wait to get back to giving hugs and welcoming people at the conferences and seeing all of you that are friends and family, and certainly can't wait to get back. With that, I'm going to move forward. I want to talk about quickly my first revenue cycle job 30 years ago. Yep, I started when I was 10. That first day I walked into that facility, they were several months behind in posting cash. Money was in the bank, but that still had a giant gap that impacted financials in a serious way. Before I arrived, in order to help catch up, they had pulled billers and follow-up staff to post cash, which resulted in lots of errors and started building gaps in the claims getting out, follow-up getting done. As you can imagine, it was a mess. The cash posting backlog snowballed and impacted cash, employee morale, turnover, and ultimately patient satisfaction. So you can kind of say my career was born in a crisis. It took months to fix, and probably about a year before we got to any kind of in the groove flow with our revenue cycle. So let's look at today's crisis and what's going on. The revenue is down at most facilities. There's been several impacts where many hospitals have downsized the non-clinical staff, including revenue cycle. The problem with downsizing revenue cycle as soon as business drops off is we're not on a timeline that business drops off today and our work decreases. We're 2-3 months back on workload. So business decreases today, we're still got 2-3 months worth of work to do before that we start feeling that downsize. And so downsizing too early has a big effect. That creates backlogs. We start shifting work to other people who may not be as proficient as those that normally were doing the job. So there's going to be an increase in errors and gaps in our revenue cycle. There's also a possible process change that happens. For our team at HRG, We went from 90% people working at the office, the corporate office, to almost 100% working from home. The daily processes had to change to accommodate it. If you didn't have to work from home at your facility, you may had to change your process due to your limited resources or limited resources in IT, accounting, or other support functions. Also, your patient financial system support may have decreased from your vendor or internally, and the shifting tools to put the focus on the clinical side may have also left you an impact. And there's the people process. We're all distracted right now. We can admit this has impacted all of us. Distractions, wrong, and worry impact our ability to be at our best. People are thinking about survival, and I don't know why, but people are thinking about toilet paper, and that toll on engagement, production, and quality is measurable, and sometimes at facilities it's catastrophic. Let's talk about the revenue cycle real quick, a little 101 reminder. There's three pieces of the revenue cycle. There's the front end, patient access, financial counseling, pre-auths. The front end of the revenue cycle is definitely impacted by work disruptions. Then we got, oops, I went too far too fast. So we got the mid-cycle, clinical, charge capture, including coding, and then the back end, billing, payment, follow-up. We're going to talk mostly today about the coding, those four areas I've got focused: the coding, charge capture, billing, payment, and follow-up. All of these areas are impacted by that, the crisis that's going on and the disruption of work. And this, even though the title is procrastination, this isn't just about procrastination. This is about disruptions and lack of employee engagement and process changes. We titled it procrastination, and yeah, there sometimes is a complacency that sets in. We'll talk about that in a little bit. So I'm finally getting the flow of this now. So let's talk about the impact of billing and coding delays. First of all, there's a cash slowdown. So the cash slowdown, you say, so what? You know, that cash will get in the bank eventually, so the organization doesn't really get hurt. Well, let's look at a really quick example of how that impacts the hospital right away, and that is the cost of DNFB here. I took this from an AHIMA conference from 2009. Seems like a long time ago, but it's still relevant today. The slide shows the cost of DNFB. A really quick example, look at day 10. There's one account for $4,500 plus in that one account. At the bottom in figure 11.7, it shows that the daily interest, and that account is staged 10 days. You do all the math, and you come up to that account has cost the hospital, by being in DNFB 10 days, $6.20. Doesn't sound like a lot, but $6.20 times thousands. And if your DNFB starts backing up, or if your billing starts backing up, think about the thousands of accounts or hundreds of accounts, either way, that can be in there, and the millions possibly of dollars that can be in there, and what that interest rate means to a hospital. That's just one simple look at a factual cash-based cost of being behind. Then let's talk about sleepless nights for your CFO and financial team. And no one wants our CFOs to have sleepless nights. That doesn't pay off for anybody. But they use our cash and revenue for projections and predicting the future. Cash projections are really important when you're looking at what I'm going to purchase, how can I make payroll, and other strategic decisions. If that is off, if that's wrong, these decisions can't be made or made incorrectly. So think about that implication when your facility needs to purchase or bring in more care, and we can't do that because the cash projections are not accurate. Think about the impact you would have with that. Let's talk about untimelies. Untimely accounts. When I first started healthcare 30 years ago, again, yeah, I was 10. But when untimely's there, it was all year, if there was any untimely in the contract at all. Now, to have a 90, 60, 30-day timely clause in your contract is not uncommon. And every day that you delay getting a claim coded or getting a bill out the door, the clock is ticking on losing that cash. And I'm sorry, but untimelies are just lost cash. Very few times can you recover that. And that's an unacceptable loss. You also have a increase in your cost to collect. That starts with errors, rework, and that cost starts to snowball. Let me give you an example. We track at HRG how many touches we touch an account to resolution for every project we do. When we started counting that back in 2009, our average was 3.4 touches on accounts before it got resolved. So every account that went through, the average was 3.4 touches. Now, here we are, 10 years later, 11 years later, we're at approximately 1.4 touches per account to get to resolution. That's due to efficiency, technical advances, things we've done different. And I'm not talking about this to brag about HRG. That made a difference, and I just want to show the dollar difference. That difference when working 150,000 accounts per month is almost $13 an account, or $2 million. So think about your facility, and if you had to add the cost of $13 to every account, what that would mean. It means one of two things: you're going to spend a lot more money to collect that money, or you're going to start getting a huge backlog. So that every time you make a mistake, that cost to collect increases, and the coding and billing delays and accuracy really impact that. Let's talk about the other non-financial cost, how to put your hand around that. There's physician satisfaction. Our billing and collections, sometimes their pay revolves around that, or their bonuses. They also have to do rework sometimes. They have to correct their documentation. And if we wait weeks or sometimes months to get it back to them, to ask them to correct their documentation, that causes problems and accuracy problems. Then there's employee morale. When I first walked into that first facility that I took over, the outgoing manager got me to the door of the department, and as she opened the door, whispered in my ear, let me introduce you to the loser club. That's how that department felt, and that's how that manager felt, and that was just part of every day not being successful, every day feeling like you're in trouble, and that takes a toll, and it's a vicious cycle. Once that's down, their production drops more, they feel worse, the production drops more, you have turnover, you're training new people into the loser club, and it's a disaster waiting to happen. The other toll is patient satisfaction. It's said a great clinical care episode can be ruined by poor financial care, and I truly believe that. And once you have patient dissatisfaction growing, the community starts grumbling. You get bad press, your reputation, and all that leads to leakage out of the community hospitals, leakage to other facilities, and your support in the community goes down, which is costly. So there's a big impact on not being timely on your coding and billing. And just think about, in this crisis, what is important for this facility. So let's look, I keep going the wrong way, sorry. Let's look at what the positive is of accurate and timely new billing. So the first thing is, you're going to get your quickest, best cash from your third party. You got to get the money in fast, you got to get it accurate, and that will turn around. Claims nirvana is, I bill a claim out clean, electronically, it goes to a payer, they pay it within 12 to 14 to 17 days, depending on the payer, comes in, cash post automatically, no other touches, doesn't cost us much to get that done, and the cash is in the bank and the account's posted, and then we start billing the self-pay part of it. That is your best money and your first priority every day, but especially in the crisis. We also want to reduce the cost of rework and denials. Again, accurate, timely billing does that. Like I said, the cost starts adding up and snowballing. So new billing being accurate does reduce that cost, because less rework, less denials. And then reduce the duplicate billing. When I first got into healthcare, again, 30 years ago when I was 10, the number one reason for denial was duplicate billing. I just looked at the Blue Cross Association top reasons for denial. In the top 5 was duplicate billing. So here we are 30 years later, we're still having the same problems. That's from errors, that's from sloppiness, that's from untimely, not working things timely enough, and then we do duplicate billing. And duplicate billing has a cost. One, at the payers who I used to work for, it slows them down, it doubles the work. And then for your staff, it also doubles the work. You have to clean out that duplicate, you have to look at that account. It's a consistent problem that has always been here in healthcare since I've been in it, and we've got to reduce that. Also, timely filing has changed a lot, like I said, and you want to reduce that loss. Some of the facilities I've been in, you walk in and it's okay to have a percentage of untimely filing accounts. In my book, it's never okay. One untimely account is a failure, and we shouldn't put up with failures. That is cash out the door, money over the cliff, flush down the toilet, and we're all short on toilet paper, so we don't want to do that. But you got to reduce that loss to untimely filing and have that attitude that it's not acceptable. And then again, accurate billing is patient satisfaction. We all know that patient satisfaction helps with retention of patients, but it also helps with payment. It's a well-proven fact that a satisfied patient has more tendency to pay timely and in full than an unsatisfied patient. So it's going to affect your self-pay down the line. So, oops, I had a consultant that I worked with, and actually I think she's on this webinar. At one point we were working on a project together. That's the person we still partner with, and we were arguing about where to put the resources to get the most done. And I wanted to drop the AR. I wanted to get more people on follow-up. We were short on billers, and she made the comment, "Hey, Greg, the sun doesn't set on an unbilled claim," and she was right. You can't let a day go by that new claims aren't out. That is your best money. You got to watch this quote. If you're in Fairbanks, Alaska in the summer, it doesn't work because the sun never sets. So be careful where you use it. Okay, I'm going backwards here. Sorry. So let's talk about the other bottlenecks and your other priorities that can happen. Again, any of these bottlenecks cause a tsunami of issues. Let's talk about cash posting. I already discussed my example. If your cash posting isn't current, all else after that is stopped or inefficient at best. Plus your secondary billing that blocks right underneath it slows down. And I asked yesterday, trying to get a number of what percentage of our cash for our facilities comes in from secondary billing, and I didn't have a good number, but there's a percentage of cash, good hard cash from payers that come in from your secondary billing. And without accurate payment posting and caught up payment posting, that's impacted. On your follow-up and denials, this is where you not only collect cash that you missed by accurate initial billing, but you find those errors that cause the initial delays. What happened? And then that feedback back to the billers and the coders of what's going on, that impacts your cash down the line. So you've got to keep that work up. You can't let that back up. Also, there's a timeliness to appeals. Most of our contracts have it in there, and if you go too long, you lose the chance to recover that money. So be careful that you don't fall down in that area also. And then there's patient billing. Again, it's a documented fact that the older account gets, the less likely and less you'll collect, and the less likely the patient's about to pay. It will also have a maximum effect on patient satisfaction. Again, it doesn't matter what their care is. You start billing them late, they get a self-pay statement months and months late, even years late. They're going to be mad at your organization, and that's where the dissatisfaction comes in. Just remember, these bottlenecks compound, have a ripple effect on the entire process and eventually the entire organization. Man, I gotta keep going the right way. So in a crisis, we gotta measure what's important. We gotta have an early warning system. These reports that I'm about to go over are not any different than the reports you should be looking at on a regular basis. What I'm suggesting here, though, is that these are your priorities to look at to make sure you're not starting to get a bottleneck, not starting to get a gap, and that you look at them more often. You up the ante, as far as I'm concerned, is looking at them, and I would suggest daily, semi-daily, hourly if you have to make sure that in a crisis you're not starting to see this bound up. So let's go through the reports real quick. As far as DNFB, is that DNFB dollar growing? And you should be looking at it as daily. Is my DNFB going up, staying the same, or luckily is it dropping? If it is, what's going on? At the bottom it says coder productivity. Are your coders being less productive? Are they distracted now because they're worried about things? Are they distracted now, or did your tools not dry up a little bit? Something going on. So if that DNFB is climbing and your coder productivity is dropping, that's a clear indication. And you don't want to wait till that doubles. You want to see it in increments of small increments to say, I've got a problem. I need to start looking and digging in. That, along with chart delinquency rate and your discharge date to code date. Those are the 4 things as far as DNFB and coding you need to keep a quick eye on. And there's so many other reports here, again, and I'm never suggesting stop looking at any other reports. I'm suggesting in a crisis, these are the things you want to keep a very close eye and very often eye on. On the billing side, your code date to bill date, is that increasing? If it's increasing, what's going on? You're in trouble there. Is your billers not getting work done? Is there a system problem again? Is your daily clean claim rate going down? Are you losing that ability? And again, that could be a people or process system problem. And you got to figure out which one, and you don't want to wait too long to figure that out. Are your rejections increasing? And can you group and pattern your rejections so you can see what's going on? Late charges as a percent of charges, is that increasing? Is there something going on in the organization that you need to get in front of? Some of these things are going to happen naturally. In this crisis, I would bet our late charges have all increased some. So, is that acceptable? Not until I look into it and see what's causing it and what's going on. And most importantly, is your billing queue cleaned out daily? You need to look at your EDI system and your report every day. Is that done? Is it cleaned out daily? And just right behind that are your secondary bills going out. Sometimes secondaries become the stepchildren. Don't let them delay. Every bill is cash in the bank as far as I'm concerned. In payment posting, we've talked about the disaster that I've seen there. The percentage of automated payments. Again, do you have a payer problem? Is there a system problem? What's going on there? Your receipt to posting days, is that starting to climb? And again, you want that early warning that I see a couple days here, what's going on? Your cash poster production on manual postings, is that decreasing? Are your cash posters, again, in this crisis, I'm thinking about today, we're all distracted. So your cash posters distracted, not quite putting the work in that they were before this. And is the error rate going up for the same reason? Those are things you want to look at quickly. And then in your follow-up denials, my biggest one is, are your high dollar accounts getting touched every so often? In my world, it's 14 days. Any account over $5,000 has to be touched every 14 days and updated. And you may have a different set of standards. You may have a different dollar amount or closer days or longer days, but is that being followed? Don't lose your eye on that. And in fact, watch it even closer. That's something I watched in our group every month. Now I'm watching it every week. What's going on a weekly basis? Are we having any accounts that are high dollars that are not being touched? Also, follow-up production. Are your reps being productive as they were before this started? Are they hitting their numbers? Did the production skyrocket? Maybe that's an indication that someone's just touching accounts for no resolution and just working them through and really not doing just to get their numbers up, which in a crisis is what people might do. Watch your accounts nearing untimely. That's your money off the cliff. You're losing it. You need to watch it. If that starts growing, right away, you need to get on top of that. We at HRG watch days since last touched. It's kind of like the high dollar account touched every 14 days. But our account average of days since last touch is set at a certain rate. If it goes over that, I know that my reps are being less productive, or there's a problem or a system problem or an overload of work that I'm not staffed right for. But that to me is a clear indication that something's gone off the rails and we need to get on it, because again, this will snowball and get worse. And then your denial rate and your appeal success rate. You know, if your denial start charging, if you're running 5% now and you start seeing it at 5.5%, 6%, something's changed. And let's get on top of that before it snowballs. And then your appeal success rate, kind of a weird number that, you know, you could be running at 80%, all of a sudden it drops to 50%. What's wrong? But it also could skyrocket if you all of a sudden have a huge jump in your success rate. What are we appealing that before we weren't, that there was no need to appeal? Does that go back to there's a billing problem, and these are appeals that really didn't need to happen because we're making a mistake now at the front? So keep an eye on those numbers. Again, this is a bunch of reports that I suggest when you're looking at what's priority. When I'm downstaffed, when my processes are messed up because there was a crisis, these are the numbers I want to look at more often for my priorities on a daily or even more basis. So the last thing I want to talk about is really the people. I gave a webinar a couple weeks ago on leadership in a crisis. It's really important, and now it's even more important that we're deeper in this crisis. Let me tell you what happened with us. We sent people home 7 weeks ago. The first 2 weeks we saw an uptick in production, and we were all smiling. Hey, look, working from home is great. These people are even more productive. There's probably less distractions, good reason. Then that settled down into where they were back to normal. Okay, at least we're getting the same. But the red flags went up. If we've dropped from high to normal, the next drop is normal to lower. And the last thing we need is to lose production. And here we are 7 weeks into it, and we have to do even more to engage our employees and make sure we don't lose production. So that's the reason I put this slide back in from my last webinar. It's more important now. It's a reminder to keep your team engaged and make sure they are part of the culture and doing the work. So let me go through this real quick. Make sure you're providing the leadership. Your people in a crisis normally, but your people in the crisis are looking for a leader. They want to know how, why, and when. Look at the nation is looking for a leader to say how, why, and when. We are looking for a leader, and so were your people, and you need to provide that leadership for them. So the best way to do that, increase your communication. Let them know what's going on. Keep them informed, but also just reach out on a relationship basis and say, how you doing today? We need to do that. If you don't do the daily huddle before the crisis began or while this was going on, you need to start that. I highly suggest a morning where you get the team together, whether they're in small groups of teams or the whole team, and let's talk about what didn't get done yesterday and needs to get done today. Did all the bills get out, and why not? So we've got to work extra hard on it. Or someone's out sick, so who's going to cover those? If you don't have a daily huddle, you're missing that opportunity. And I'm talking 5-10 minutes at the most of just, hey, here's what yesterday happened, here's what's today. And it's really a good way also to just get everybody together, whether you're working from home, get everybody together that now they're missing that kind of camaraderie at the office, or even if you're still going to the office, just a reassuring that we're here, we're all together, we're doing this together. Don't forget to recognize the good things that happen. More important than ever, celebrate successes, pat people on the back. We're sending out emails. When something good happens, we're sending out an email. We had a gal the other day kind of ring the bell and say, hey, this isn't going to work. And matter of fact, on this project that we're doing, if we do this, the client could lose money instead of gain money. And out on her own, she rang that bell, called me, called her director, and we stopped the process and fixed it. And now an email blast will go out to the company saying, hey, she did a great thing. Congratulations. And we want everybody else to see that. She's going to feel great about that, but we want everybody else to see, hey, we're recognizing accomplishments. Don't forget to give them the tools to be successful. Really important that in this crisis, some of the things changed. make sure the tools are still good. And if the tool goes away or can't be used, give them something instead, or help them through the process to make that better. They need to feel successful. Eliminate the preventable sources of pressure. Don't take that project that you had in your mind you were going to do that isn't going to change anything today or help in this crisis or put cash in the bank, and don't have them start it now. Put that aside till things get back to better. And then the last thing I want to talk about is when things get better. Seize this opportunity now to be innovative, have your team be innovative and engaged, and talk about not when things get back to normal, but when we get back to work and things are even better because we've learned from this crisis, we're stronger, we're a better team, and seize this opportunity. And that's what your team is also looking for, that, hey, not only do we see the light at the tunnel, but the light's brighter because we're better because we've learned. And this is a great learning opportunity. Real quick, let me summarize. There's a cost of a stall, a direct dollar cost, and then there's other costs to your organizations that could hurt deeply the organizations. You want to watch your cash. That's the number one priority, which is billing out the door, getting your D&FB worked and down and your bills out the door, and watch for early warnings and watch those reports. And then don't forget your team. Keeping the team engaged is the key during a crisis. And most of all, think forward. Look at how you're going to come out of this crisis and look better. So with that, I am going to turn it back over to Taylor, and I'm going to go back to the last page if I do this right. And Taylor, take back over.
Awesome. Thanks, Greg. Really great information that you shared. We will be sharing the webinar recording and slides in an email later today. Included in that email is a link to a survey. We would so appreciate you letting us know your thoughts on these webinars. We are taking these responses super seriously and incorporating as many topic recommendations as we can into this series. Additionally, in that survey, you can request a certificate of attendance, and upon the completion